This poster is representative of the Opioid Mortality Review Board program that was created in response to the increasing number of opioid-related deaths over the past 5 to 7 years. Specific to Erie County, the Medical Examiner's Office has identified numerous synthetic opioids, both legal and illegal, some of them hundreds of times more potent and faster acting than heroin alone, in the toxicology results of those deceased. The Opioid Mortality Review Board is a formative process that integrates representatives from emergency medicine services, high-intensity drug trafficking areas, New York's 8th Judicial District Treatment Courts Program, behavioral health, addiction medicine, a research partner, and a peer. This group of experts involved in high-level policy and program initiatives is tasked with attempting to create advanced, decisive recommendations that will be presented to the Erie County Opioid Epidemic Task Force. This task force includes organizations concerned with the opioid crisis that collaborate, develop, and share best practices by dissemination of information. The program's process of collecting all the information surrounding opioid overdoses is the most fundamental component of the project. The nurse and peer play key roles in this process by conducting thorough review of interviews of all elements of life, such as family and friends, relationships, mental health, education, trauma history, medical and criminal history, events surrounding the overdose, toxicology, involvement in social services and treatment, and many more aspects. In-depth review of individual cases at review board meetings work to develop meaningful recommendations, which are then reported to the Erie County Opioid Epidemic Task Force to create best practices and improve current strategies. The research partner works closely with the Erie County Department of Health to not only create guidance on collecting this sensitive information, but to review data trends and support the Erie County program team in any improvements and modifications they encounter when collecting and presenting the data. Next steps of this process will include formalizing the recommendations that are produced from the Opioid Mortality Review Board and collaborating with the Erie County Opioid Epidemic Task Force to make comprehensive, real-time improvements in policy and programming across organizations immersed in the opioid crisis.